This is the Invite Health Podcast, and I am Amanda Williams. Menopause, diabetes, hypothyroidism, other hormonal fluctuations, obesity, being overweight, these are all risk factors and potential causes for something that can affect upwards of 20% of the population. And I want to discuss that in some detail today. I am referring to carpal tunnel syndrome, and that is what today's episode will focus on. But before we get started, just a friendly reminder to subscribe to the Invite Health Podcast today. Leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's talk a little bit more about carpal tunnel syndrome. Many people have heard of carpal tunnel syndrome, and we usually correlate it with people who are sitting in front of a computer and using a keyboard. And it's that repeated use that can create or drive up many of the symptoms that people can experience, and that can be, very painful, numbness, tingling within the wrist itself. So when we think about our wrist joint, so we think about you get pain within the wrist itself, oftentimes into the first 3 fingers. And you can even have pain that can radiate up the forearm. So carpal tunnel syndrome is actually very prevalent. When you look at the rate, this can be upwards of 20%. We're looking at lifetime prevalence of people in the United States who can at some point throughout their lives experience carpal tunnel syndrome. There are many different approaches as to how to target carpal tunnel syndrome. Now, the reason we know that this is so common and so prevalent, you can look at carpal tunnel surgery. And this is when they go through and they are actually releasing the transverse carpal ligament. This is a very, very common procedure. And for many people, once they have this procedure done, it relieves a lot of those symptoms. So that pain within the wrist, that numbness, the tingling, pain that radiates up the forearm. We know that when it comes to that particular procedure, there's over 500,000 of these procedures done annually in the United States. So this is a big chunk of the population who is dealing with carpal tunnel syndrome. And oftentimes people are seeking out advice as to what they can be doing. The reason in the beginning I mentioned the different risk factors, because when we throw in things such as obesity, knowing that 2 out of 3 adults in the United States are considered to be overweight or obese, when we look at diabetes and metabolic syndrome, understanding how many Americans are either of a type 2 diabetic or pre-diabetic, millions, estimated 80 million pre-diabetics in this country. Then we look at hormonal issues. Certainly we understand that because of the environment to which we live in, with different chemical exposures and air pollutants, all of these endocrine disruptors, that hormonal imbalances can be a driving force as well. So even when we look at issues with menopause, we can look at issues with women going through pregnancy. For example, oftentimes they will experience higher incidence of carpal tunnel during pregnancy. So hormones, remember, those are your chemical signals, those little messengers in the body. And if they get thrown off, they can throw off so many different things. I like to bring this up because we know how many people are affected by some of these chronic disease states. And looking at things like hypothyroidism or Hashimoto's thyroiditis, and the connection between the immune system, inflammation, and carpal tunnel syndrome. Carpal tunnel syndrome itself occurs because you're getting irritation or compression of the median nerve. And the median nerve is going to travel down from, basically we're thinking under the armpit, and it traverses its way all the way down into the wrist and into the hand through a canal called the carpal tunnel. So when people are sitting at a keyboard, for example, or people who are doing repetitive use work, or perhaps you had some type of a traumatic injury done to the wrist or to the hand, these we know are evident risk factors. But where people sometimes are not aware is all of these other causative risk factors. The autoimmune conditions, looking at issues with chronic inflammation, looking at being overweight or obese, looking at hormonal imbalances. These are the things that I want to bring to the forefront for you, and then talk about some nutrients that can help to optimize the health of your wrist, the median nerve, and things that you can do on a regular basis to make sure that we're keeping inflammation at bay. So we're going to take a quick break. When we get back, I'll tell you more about it.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. Let's talk a little bit more about carpal tunnels. Remember, carpal tunnel, this is this tight passageway that is comprised of connective tissue and bone, and this is the canal in which tendons and the median nerve travel through. If we have an impingement of that, then this can create significant amount of pain for us. We know that there are different causative reasons. We can look at repetitive use, using a keyboard, certain occupations where you are continuously doing the same action over and over certainly can play a role, but we have to be considerate of other factors as well. When we look at certain chronic disease states, when we look at issues such as pregnancy, for example, this is one area that I said I wanted to kind of highlight, because when we look at the hormonal implications and that correlation to carpal tunnel syndrome, this is kind of a big facet of the population who ends up with carpal tunnel. It's reported to be as high as 62% of pregnant women will develop carpal tunnel syndrome. Now, I think that that's quite interesting, because that's kind of a lot of pregnant women who can experience issues within that joint and within the carpal tunnel itself. That was actually published in a study back in 2010 in the Journal of Muscle Nerve, looking at the pregnancy-related carpal tunnel syndrome. And that was what they were able to decipher from all of their data collection, was 62%. And that is something that I think we cannot underestimate and we cannot overlook. When you consider what it is that hormones are doing, and we think about what happens when we have excessive oxidative stress and how that can drive up inflammation. And they know this because they can look at different levels in our blood, in the serum, for example, looking at markers for inflammation. But obviously with carpal tunnel syndrome, the primary diagnosis comes based off of symptoms. So people aren't going to present with anything other than the fact that they are experiencing pain, numbness, tingling within the wrist, within those first 3 fingers of the affected hand. Now, at that point in time, there are a series of different diagnostic physical exams that can kind of give more insight to indeed determine that it is carpal tunnel. But there are many different ways that we can look at markers for inflammation, recognizing that we have correlations between cardiovascular health, atherosclerosis, the risk of carpal tunnel syndrome goes up exponentially once again when we're dealing with other systems that may be kind of revved up or kicking out more inflammatory cytokines. And certainly to me, one of the areas of most interest really comes down to those hormonal pathways and the statistics alone when you think about pregnancy and that correlation. But we can also look at metabolic syndrome and diabetes. It's estimated that anywhere between 10 to 25% of diabetics will have carpal tunnel syndrome. And you may look at that and go, oh, that's a pretty significant number. But these are the things that sometimes are overlooked. You can have someone who's a diabetic who is experiencing issues with damaging effects of their diabetes and excessive glycation, oxidative stress, once again, that can do damage to the carpal tunnel canal itself. So these are all just things just to be aware of. There was a study that they did looking at the implications of diabetes, and this was published in the Journal of Diabetes Complications back in 2010, drawing that correlation and really being able to see that increased risk of severe carpal tunnel syndrome in type 2 diabetics. So there are different ways. Another study back in 2013 was looking at that as well, and the prevalence of obesity, the prevalence of, insulin resistance, metabolic syndrome, and how all of these can certainly be correlated. So there's so much information out there. Oftentimes we just kind of chalk it up to, okay, yeah, you're having numbness and tingling and pain, and maybe you need to wear some type of a wrist splint or something. A lot of people have seen the keyboards that have the elevated or raised keyboard. So this sometimes can help, but once again, if we're not addressing underlying issues such as hormonal imbalances, looking at the role of hypothyroidism, for example, these are all things that certainly can drive up the risk of the development of carpal tunnel. So I'm going to talk about some more of the other potential risk factors, and then we'll talk about some of the nutrients, but we're going to take a quick break. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. I wanted to mention just one other point when it comes to potential risk factors. There was a study that they published in the Lancet Oncology Journal back in 2012 that was drawing a connection between carpal tunnel syndrome and women who have been treated for breast cancer with certain medications. And one of the medications in particular that they honed in on in this study was the drug called Aromacin. And they found over this follow-up period, which was roughly about 7.5 years, that women who were taking the Aromacin had over a 5-time greater likelihood of developing carpal tunnel syndrome comparative to the women who were being treated with tamoxifen. So when I talk about that hormonal connection, there clearly is a link there. And I always like people to be aware of that connection. My best advice generally is to always have your hormone levels tested and assessed. And, doing this, earlier in life is generally a good idea. Oftentimes, though, people don't go out and seek any type of hormonal advice until you are actually having particular symptoms. And when you think about something like carpal tunnel, that's the last thing anyone's thinking of. They don't draw into that correlation of loss of estrogen or progesterone and the connection with carpal tunnel syndrome development. So it's just one of those things where I say if you're consistent with always looking at where your hormone levels are, oftentimes it can give you some insight as to things that have gone awry in the body. Now, when it comes to what people can do if they do have carpal tunnel syndrome, we know what the conventional treatments are. We talked about the surgery option. Oftentimes people will get corticosteroids. Usually these are taken in an oral form. Sometimes they'll do an injection. And many times your primary care physician will just tell you to take NSAIDs, which are the non-steroidal anti-inflammatory medications. The problem with that is we know that some of those NSAIDs can lead to a greater risk of problems when it comes to kidney health or liver health. And oftentimes people are seeking out alternative options. Well, there are many different ways that you can incorporate nutrients into your routine that can really help to optimize the way that your nervous system and those tendons are responding. So we'll just kind of cover some of the basics. Omega-3 fatty acids in particular is a real key nutrient to make sure that you have on board, not only in terms of supplementation, but also when it comes to your diet. So adhering to that Mediterranean style diet, once again, is very crucial. Looking at how omega-3 fatty acids coming from things such as fish oil or krill oil, for example, what we know about omega-3s is that they can help to offset inflammation in the body. If we are in a state of hyperinflammation, then this can lead to some problems. And we know this certainly to be the case when we're looking at any type of chronic disease state. So having omega-3s as part of your supplementation routine is always advantageous. We can also look at B vitamins. B6 in particular has been assessed in quite a bit of detail when it comes to carpal tunnel syndrome. And many of the studies out there on vitamin B6 have found evidence that when people have low B6 levels, this can actually increase that likelihood of carpal tunnel syndrome developing. So when they had a cohort of patients who have been diagnosed with carpal tunnel and then they did a B6 test, they were able to see this deficiency status that was actually occurring. So these are the little things that many times people don't realize. Even taking just something as simple as a B complex may provide you significant support. Now, the study that they looked at with B6, that was done all the way back in 1989, and it was in the Archives of Surgery journal, looking at that B6 level in patients with carpal tunnel syndrome. So we know that there are certain B vitamins certainly that play a key role when it comes to our central nervous system and our peripheral nervous system. So we can look at different vitamins such as B12, B2 may also be beneficial in that setting of carpal tunnel syndrome. But we also have to be considerate of things like oxidative stress and how we can go about targeting those free radicals that can be exacerbating the situation when we're looking or dealing with carpal tunnel syndrome. So that's why nutrients such as alpha-lipoic acid, acetyl L-carnitine, so L-car oftentimes is how it's shortened, and alpha-lipoic acid. We know alpha-lipoic acid is a endogenous antioxidant and has a very powerful antioxidant capacity to it. So when we see situations such as diabetic neuropathies, for example, we know diabetics are more prone to that development of carpal tunnel syndrome, then having nutrients such as alpha-lipoic acid as part of your arsenal, once again, quite advantageous. We can also look at different nutrients that we know target and ease inflammation in the body. So we can look at things such as curcumin. We know that the curcumin, when we compare that to something like an NSAID, the over-the-counter or prescribed non-steroidal anti-inflammatory drugs, curcumin is a really wonderful option for so many people out there. We know that the curcumin itself is targeting the main areas to where inflammatory cytokines are released and can drive up inflammation. So if we're taking curcumin as a supplement every day, then this may help in terms of easing that inflammation. But we also have to be considerate of things like proteolytic enzymes. And proteolytic enzymes work by means of going through and trying to target low levels of inflammation. So we think about the carpal tunnel, and we think about all of the inflammation that's occurring within that tendon, within the wrist, and going down around that median nerve and into the hand. Then utilizing nutrients such as bromelain. Bromelain is so interesting. This is a proteolytic enzyme that is derived from pineapple. So from the stem of pineapple predominantly is where we find this really wonderful source of bromelain. So bromelain can go in and kind of work through and chop up all of that inflammation. I generally advise that when people are utilizing bromelain that they take it away from food. When we take it with food, it works wonderful as a digestive enzyme to aid in the breakdown of things like protein. So if you have, a heavy meal that has a lot of protein in it, having bromelain on board helps to break that food down. But when we take it away from food, it works really wonderful as this specified way to go through and find that inflammation. So these are some of the main nutrients. B vitamins, so we can do a B complex 100 that we offer is a really nice way to do this, because that's going to give you the full spectrum of all of those B vitamins, including B6 and B12 and B2. We can also look at alpha-lipoic acid, acetyl L-carnitine, omega-3 fatty acids, including things such as fish oil and krill oil. These are all ways for you to be able to offset some of the inflammatory processes that occur in the body that can lead down that path to chronic inflammation and even to things such as carpal tunnel syndrome. For those who are suffering with carpal tunnel syndrome, obviously being on a routine such as this on a daily basis should provide you significant support. So always keep that in mind. When you're not exactly sure as to what you should be doing, always make sure that you reach out to an expert who can assist you in making sure that you're on the targeted nutrients to optimize your overall health. So I'm going to wrap things up for today, and I want to thank you for tuning in to the Invite Health Podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure you subscribe and leave us a review. Follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of Invite Health Podcast.